Newly released government data reveals alarming trends following Canada's COVID-19 vaccine rollout, especially in reproductive and menstrual health. Health Canada's own reports show adverse events for pregnancy and fertility skyrocketed in 2021 and 2022 with no explanation. Meanwhile, Canada's fertility rates have plunged to a record low, and yet Health Canada continues to insist the vaccines are safe, even though their own numbers allude to a different tale. So let's dig in. Newly released information from the federal government just dropped, and as per usual, it raises more questions than answers about Canada's aftermarket surveillance of the novel modified RNA COVID-19 injections, particularly when it comes to reproductive and menstrual health. This data comes straight from an official government response tabled in Parliament, and while the government insists Canadian vaccines are safe and effective, the numbers they themselves disclose paint a different and much sharper picture of what actually happened in the 2 years following their rollout. The official parliamentary response starts with adverse events reports involving obstetric, fetal, neonatal, or reproductive outcomes. That means any miscarriages, stillbirths, preterm births, congenital anomalies, etc. The government says that since 2020, Canada's National Adverse Event System logged only 85 reports in this category. I guess it's easy to say only when you're not the one dealing with the physical reality behind these reports. But here's where the timeline becomes extremely important. 2020, the first year of the declared global pandemic, saw exactly 0 cases in this category, despite the repeated claim that COVID infection is especially risky for pregnant women. But then there is explosive growth in the year directly following the mass rollout of these novel injections, from absolutely no cases to a staggering 58 in 2021. In 2022, it comes back down, but is still alarmingly higher than in 2020 at 17 cases. And then it dwindles down to 8 in 2023, followed by 1 each year since. The overwhelming majority, almost 70% of all such reports ever submitted, occurred in 2021 alone, the first full year of mass vaccination in Canada. That's not just a gentle increase, it's a vertical spike. Yet the government's response provides no explanation for why 2021 saw such a dramatic surge or what changed in 2022 that caused reports to teeter back down. Was it decreased reporting? Was it a change in public messaging? Or something else entirely? We don't know because the government doesn't say, and it seems that they're happy to ignore the reason. Now let's look at menstrual changes, including heavy bleeding, amenorrhea, which is when you don't get a cycle at all, and other irregularities. According to the same federal response, since 2020, Canada recorded 928 menstrual-related health reports following the mass vaccine campaign. What stands out most is, once again, that vertical spike in these reports following the rollout of the novel injections. There were no reports, 0, nada, zilch, for the duration of 2020, the year of the pandemic, then followed by a sharp jump to 556 in 2021. The surge in reporting is substantial and deserves clear, careful examination. When it came back down to 264 in 2022, then it's tapered off since, but it's still not returned to 0 5 years later. Again, the pattern is unmistakable. Even though the government repeatedly stresses that reports do not prove causation, they still represent real people, real medical events, and real concerns. And the trend line, which is a massive surge immediately after rollout, followed by a steep decline, definitely deserves a deeper dive, not a quiet dismissal, as Health Canada seems to prefer. Also worth noting here is that Constable Helen Gruce from the Ottawa Police Services faces ongoing career-destroying disciplinary action and massive legal fees to defend herself from accusations surrounding her urgency looking into this record, roughly 3-fold increase in sudden infant deaths in the months following this massive, unprecedented novel injection rollout in that region. Repeatedly, Canadians are reassured and multi-million-dollar propaganda campaigns were spent to ensure that you viewed these events as not a big deal or unrelated. So it's not surprising that the government's response also reveals something else, which are significant gaps in oversight. Health Canada openly admits it cannot access claims submitted to the Vaccine Injury Support Program called VISP, since the federal initiative outsourced administration to the private company Oxero, which is formerly RCGT. It's a convenient way to wash their hands of accountability. But as my reporting has shown, this program has been a fiasco and a racket from day one. Remember, according to my exclusive investigation at rebelinvestigates.com, which then resulted in my launching of the campaign at nomoreshots.ca, not only did it take Oxero nearly 3 years to figure out how to administer this program, which was initially only supposed to run for 5 years, but they struggled to determine compensation amounts for children. The consultants rake in 60% of the budget allocation, and victims are waiting left in the midst, offered state-sanctioned euthanasia instead of the help they were promised. Right. But there are VISP people who have gotten MAID, the medical assistance in dying. But you don't know how many.
No, I can't really know how many.
So let's just drive this point home for a moment, because this is a clear admittance that the federal regulators responsible for authorizing these products and subsequently responsible for monitoring their ongoing safety did not actually see compensation claim data. That's not exactly what Canadians picture when they hear robust vaccine safety system. And when asked whether menstrual and reproductive outcomes would be included in an expanded program, neither agency provided a commitment. Now, despite the sharp spikes in reporting, despite the lack of VISP transparency, and despite Canadians' ongoing concerns, the government maintains their position. No evidence of increased risk of heavy menstrual bleeding, no evidence of increased risk of miscarriage, and no evidence of increased risk of preterm birth or complications. Yet those very concerns are numerous enough that the government acknowledges having reviewed them, studied them, and even published a safety assessment in Health Product Info Watch in 2023. Why review something so extensively if there was never any signal worth investigating? It's a contradiction, and it's one that this parliamentary exchange brings into the forefront of Health Canada's inconsistencies, especially since there is a lot of evidence correlating COVID vaccines and menstrual changes, like this large international study showing vaccinated individuals experience measurable cycle increases, or this one showing that 1 in 5 participants reported shorter duration, heavier bleeding, more frequent, more painful, and more severe PMS symptoms post-vaccination. This one also found evidence linking COVID-19 vaccines to menstrual changes, concluding that future vaccine trials must rigorously track menstrual cycles to uncover biological mechanisms, reduce bias, and understand the full impact on health, which the original clinical trials didn't do. These are just scratching the surface, which makes it clear that there were and obviously still are many unknowns and uncertainties with these products, and Health Canada refuses to communicate that. Former Public Health Officer Theresa Tam knew the full extent of injuries wouldn't be known until the shots were rolled out onto the population at large. So how exactly can Health Canada make such sweeping safety assertions and acknowledge such a stark increase in adverse events simultaneously?
Every medication or vaccine can come with rare side effects, which will not be picked up until many millions of people receive the vaccine. The initial clinical trial with tens of thousands will not pick up rare events.
Now, this pattern is worth highlighting as an area of interest and continued study. These experiences deserve to be taken seriously, not disregarded. This official data isn't just a gentle uptick either. It's an explosive one, concentrated almost entirely within the first 2 years of the vaccine rollout. Then, as quickly as the spike appears, it comes back down. It's almost as though it comes back down right when people were exiting the endless COVID booster revolving door. You see, 81% of Canadians got at least one dose of the COVID shot by the end of 2021, yet fewer than 4% are now considered up to date. Even the government's own research shows booster willingness dropping sharply by roughly 22 to 51 percentage points between the earlier rollout in 2021 and 2023. So what changed? Improved safety, less surveillance, or just fewer people lining up? The government doesn't say, but these numbers come as Canada's fertility rates also hit a record low in 2024. Total fertility dropped 7% in 2022 and just over 5% in 2023. For context, the 7.4% decline from 2021 to 2022 is the largest single-year drop in recent decades. So Health Canada's confident messaging, well, it doesn't really square with its own data. And this parliamentary response left a lot to be desired, not only in terms of transparency and oversight, but also just basic curiosity. These numbers come from the government itself, and asking why they clash with the official narrative shouldn't be treated as fringe or conspiratorial. But Health Canada, well, they just want you to take their word for it. Trust the science, as they say.
COVID, it's time to finish this pandemic for good. So get vaccinated.
Vaccines are the best way for you to protect yourself, your family, and your community.
We're all in agreement. This is not a partisan issue, so please get vaccinated.
It's time for everyone to do it. Get the shot.
Get the shot.
For Rebel News, I'm Tamara Ugolini. To find more reports just like this one with the data and the evidence, head on over to nomoreshots.ca and consider supporting this fearless journalism if you appreciate it. That's nomoreshots.ca.